HIB initiative was formed in 2005 to address the issues delaying introduction of HIB vaccine in developing countries.
For many years, this vaccine couldn't be accessible, so it was good to think about a way to facilitate decision-making processes at the global and country level for the children to access those vaccines.
Supported by a $32 million four-year grant from the Gavi Alliance, the initiative was a consortium between the World Health Organization, London School, Johns Hopkins, and Centers for Disease Control and Prevention.
It was really important to think about strategic partners who could offer complementary skills, who could help cover the world together, and who could raise questions.
The consortium united not only epidemiologists, but others with marketing, advocacy and communications, economics and industry experience. Together, they took a collaborative, country-driven approach to facilitate evidence-based decision-making at the country level for HIB vaccine introduction.
We had a technical advisory group that included people from every region that was still having a lot of HIB disease. And they were a sounding board for us, particularly in the planning phases, to make sure we weren't missing things, we weren't seeing things with too narrow a lens.
Incorporating additional perspectives may have further strengthened the team.
And I think going forward, it may be important to include more developing country institutions as part of the original consortium. You know, I think it's just important to have lots of perspectives represented, and that might have been a gap that we had.
The HIB initiative focused on three strategic areas: communication, research, and coordination. The consortium worked to ensure that regional officers and partners were providing consistent messages and functioning as a team.
It was very important early on to start having as many in-person meetings as possible, on a personal basis preferably, and then by phones and video conferences and conference calls also.
Internal communications efforts included both semi-annual retreats with the regional offices and weekly HIB operational team calls.
I think a regular coming together helped the consortium members to understand some of the constraints that the regional offices are working with, some of the realities of working with 72 of the poorest countries in the world.
Although the structure worked relatively well, coordinating partners from across the globe and a variety of backgrounds did present certain challenges.
Given that we had all these different competences, one of the challenges was making sure that the work that was actually going on at country level wasn't jeopardized by everybody's enthusiasm to get their piece of the agenda worked on.
The team also had to balance the desire to accelerate the decision-making process with the need for more data.
In my view, there is a conflict between the process of advocacy and the selection of research projects. And the result is a tendency to avoid the kind of research which carries the risk of throwing up difficult or unexpected findings. And it was trying to match these two different approaches was really a challenge, and I think it's an important lesson for future projects to take on.
The HIB initiative experience provided important lessons on not only consortium management, but also on strategically approaching key goals.
The timing of the HIB initiative is an important question, and I think that probably everybody associated with Gavi would recognise that it would have been better, in fact, to have started it several years earlier. I would be thinking right now about vaccines that I was going to be introducing in 5 years' time.
One of the activities that I also think we could have done a little bit earlier was having better access to some of the quote-unquote difficult countries, or the countries presumed to be late adopters. As it turned out, many of these countries were not that resistant to vaccine introduction once you understood the decision-making process.
It was also important to establish partnerships with suppliers to ensure continuity of supply and good planning.
We really did not expect the demand to grow so fast and in such a short time. I think what really supported and helped to establish the partnership between the manufacturers and the HIB initiative was the attitude of transparency and openness. And I think that this feeling of partnership is something that HIB initiative really brought to the manufacturers and made a difference in the relationship between the public and private sectors.
The HIB initiative also needed to weigh how it allocated resources among its strategic areas and learned important lessons in retrospect.
Communication and advocacy was really one of the major pillars of our strategic approach. I would recommend allocating adequate budget from the beginning to ensure that all the communications and advocacy needs are met.
The success of the HIB initiative and the lessons we can learn from it provide an important blueprint for future initiatives.
The way that the initiative was structured is, I think, what will certainly facilitate the uptake and implementation of other new life-saving vaccines like pneumo, rota, and many others.
I think also from the institutional perspective, it demonstrated that we were able to organise ourselves into a multi-continental consortium that was able to actually operate on a global scale. This is something which I think before the beginning of the project people doubted, but I think that our teams demonstrated that in fact was possible and worked extremely well.